Hello and Assalamu alaikum. Ultrascan diagnostics. This is the CBCT of the patient that you had requested. The area of interest is the upper right first molar region, the upper left premolar region, and the lower right and left first molars. Now, on the panoramic view, you can clearly see that the upper right first molar is missing, the upper left first and second premolars are missing, and the lower right first molars have a few cavitations. Now we will take you through the each and every segment. So this is the upper right segment. So this is the upper right segment. The upper right segment is edentulous. We can see that we only have bone height of approximately 1.6 millimeters. We have severe sinusitis present in this case as well, maxillary sinusitis. So in this tooth, it will be absolutely difficult to place any implant in this region until unless a lateral window sinus lift technique is not applied, and hence we cannot place a virtual implant in this region either. Moving to the upper right premolar region. In the upper right premolar region, this is the first premolar region. The ridge is quite significantly thin. If you can see, we only have 3.3 or approximately 2.9 millimeters of ridge width with approximately 10.5 millimeters of ridge height. Now, this is the first premolar region. As we move to the second premolar region, that is exactly here. In the second premolar region, we do have some width, but the height is significantly less, if we can show you, which is 4.3. So in both these areas, implant placement is going to be significantly difficult until and unless bone augmentation procedures are not performed. Moving to the lower right first molar, the lower right first molar has a very grossly carious situation right there. That's where the lower right first molar is. We can see on the distal surface there is a cavity present, and the cavity is in very close proximation to the distal pulp point. Here we can see that the cavity, when it will be cleaned, can cause infiltration into the pulp chamber. As we move to the lower left first molar, in the lower left first molar, we don't see any significant cavitations. We do see a little bit on the distal surface right there, which is just enamel and is significantly far away from the pulp chamber. On the axial view, we can show you all the bone structure. So this is the thin bone in the upper right first molar region, and the relatively thicker bone in the upper left premolar region. As we move down to the molar region, we can see that this lower right molar is significantly or grossly carious, whereas the lower left is slightly carious on the mesial aspect right here, which is visible on the axial view, and we have a slight cavity present in the distal aspect, which is going to be in this region. But if we move to the lower right 6, we can see that there is a cavity right there. It's quite significantly deep, and it is in very close proximation to the distal pulp points, especially the distal lingual pulp point. So if you have any further questions regarding this case, please feel free to reach to our team. I will, however, also tell you the working length should you choose to perform an endodontic procedure. The working length of the lower right first molar is going to be approximately 20 millimeters of the distal canal and approximately 20 millimeters of the mesial canals. We've got two mesial canals and we've got one single distal canal. Thank you very much.